Hi everyone, I'm here with my good friend Nicola McLean right here, and we're going to be explaining to you a little bit. Well, we decided we'd show you how Botox works, so it's kind of the different areas because people don't really know what they are. So we're just going to start at the beginning with the stuff that everyone knows, like 3 areas that everyone talks about, like even in the back room of a salon or something. So the first one is, if you just raise your eyebrows for me, Nick. Okay, great. So you can see some of these horizontal lines kind of that happen, and a lot of ladies will get those. They're really common at the top of the forehead. So those are easy to get rid of, and those get injected for a lot of people all the time. That's your area 1. If I get Nick to frown down, look like that, yeah. And you can see all this frowning, angry muscle, and someone must have been annoying Nick a lot lately because this has gotten really, really strong. So I wonder who that might be.
Well, we can talk about that, but that would take a whole lot of time.
That'd be a whole different video, wouldn't it? I'm going to get you to just tilt a little bit to this side, huh? No? Yeah, that's great. And smile for me. And then you're seeing that she doesn't have a great deal of problem with crow's feet or anything going on around the lines, but we do still put a few drops here preventatively, and a lot of ladies will get these lines that happen just kind of around where the eye is on the side. Okay, I'll get you to look forward again. So those are like your 3 areas that everyone knows about, but there's a whole lot of other areas that people can get with the right expertise if you know where the muscles are. So a lot of other things you can do. So I'll start by telling you a little bit about those. One of them is the brow lift, which people request a lot. So that can happen in a few ways. You can arch the eyebrow up a little bit in the middle. Why don't I just tilt you this way again? You can arch the eyebrow a little bit in the middle like this, which is quite a nice look, or some people like it a bit more exotic. And Nick just gets me to experiment on different times, depending on how she's feeling. All right. When you come around the eye, there's another one that you can do, which is quite a cool one to do. It's kind of difficult because you need really small doses, but you can actually inject Botox all the way around to the lower part of the eye so that it opens up a little bit. So that gives that really kind of youthful appearance and quite sensual because you're seeing more of the eye, and it smooths these lines underneath a little bit. So you can kind of inject all the way around. That's quite a good treatment. So next, we're going to look at these bunny lines that happen if you scrunch your nose up. Yeah, so sometimes Nick gets me to treat these, sometimes she doesn't bother because it is a slightly scratchy injection, but you can see that these ones, if you smooth them over, it stops you from making that face. Some people find it cute, and some people just think that they don't want to have it.
I felt quite cute when I did
Did
that.
you feel?
Yeah, I really did.
Didn't you feel cute the rest of the time? I think you probably feel cute all the time. This brings me to my next one, though. I love it when you smile like that. So what we're seeing is she shows a little bit of gum when she smiles, but in a really nice way. Some people will show loads of gum, so they'll show like layers and layers. I'm not going to open your mouth up for everyone, but like huge columns of gum going all the way up to below the nose. So that's a little bit of a problem. Those people have a gummy smile. That can be corrected with just a couple of, injections, really small injections in the muscles that lift the lip up so that it doesn't lift the lip as strongly. So you don't see loads of gum anymore, because that's cute when you're about 6. But after that, you probably don't want huge amounts of gum on display. While we're in the region of the mouth here, everyone's seen ladies, if they smoke or if they just have sun damage or just generally are a little bit predisposed to making certain facial expressions, people that have lots of these vertical lines, those barcode type of lines, or some people call them smokers' lines, although you don't need to smoke to get them. And sometimes we put a few tiny, tiny little drops of Botox in those just to stop them from scrunching that muscle up tightly. So if you make that kind of puckering then you can see that's how it happens. So by injecting along those, that doesn't happen as tightly, and those lines improve a lot. So that's pretty useful to get done as well. You've got to be careful with that, because if you don't inject the right amounts, people will end up speaking really strange words that don't exist. So it's another thing you need to be careful that you have someone doing that who knows what they're doing. Right, we're going to start talking a little bit about the lower face now. So these corners here, you can see in Nicola's case, actually, we don't have a problem here. It looks really nice, the corner of the mouth. It's quite horizontal, or maybe even going up a little bit at the side. Let's just tilt you this way. But some people will have it where it's really dragging down. Those are the people that everyone calls out to, like the builders and stuff call out to them saying, cheer up, love, and stuff. And that's because of that muscle that pulls down here and causes a really droopy, sad look. Even when people aren't sad, people keep asking them what's wrong. So a lot of ladies will come and say, I don't feel sad, but everyone says I am. So that's corrected by just injecting here. It's kind of tricky to find that muscle if you're not used to it. So we got to find that, track that down, and then it just stops this pulling down, and you get a little bit of a lift here at the corner of the mouth, a happier kind of look. So a good treatment, and make sure you go to someone who knows where those muscles are, because if it goes even slightly in the wrong place, you end up getting food stuck here under your lip when you're trying to eat. You don't want that, do you? Not at Gilgamesh, not anywhere else for that matter, not at SDK even. I mean, it's tasty, but you don't want it under your lip all day. Let's get you to show me that little chin face that we do. So it's hard for Nick to demonstrate this because you don't really have a problem. So some people get this kind of peach stone type of appearance, or like a golf ball of the chin. Basically, it's really puckered all the time. And people that have that is just because the muscle under here is in a little bit of spasm. And just by injecting into it, you can really relax that. So if you imagine, most people have seen that's like a golf ball appearance, or like the stone inside of a peach. And that can be fixed pretty easily. So the next thing I'm going to talk about is some of the treatments that you can do in the lower face. And a lot of people don't realize that there's a lot of really effective treatments that you can do, especially in the jawline with Botox. And it's a really useful thing that a lot of people can benefit from a lot, but people don't kind of know it exists. So what happens is there's these muscles here that people chew with that sometimes just have more bulk in them than is necessary. And sometimes it happens because you're grinding your teeth, or sometimes people just have that problem. And what it does is it gives a girl a little bit too much of a square jawline. And that's good for a guy because he wants to look like a caveman, and that might be attractive. But for a girl, not so much. You kind of want it to taper in a little bit more towards the chin. So if there's some excess squareness that's going on, or too much muscle here, bulky stuff here in the lower jaw area, then you can inject some Botox into these areas. And about 8 weeks later, you kind of gradually get that reduction in this, and it wastes away a little bit so that you get a much more elegant jawline where it comes in a much better arc from the top of the cheek here in towards the chin without going square. So you can actually modify the jawline really well with some simple injections. And that gives a great result, but especially when you combine it with the second technique, which is shown actually in the neck area. So if I get Nicola to do this special face that she's been practicing for you guys, then you can see these cord-like, band-like muscles. And a lot of people have them here as well at the front, where you're not seeing it as much in her case. You can relax. That looks tiring.
I'm knackered. All this Botox talk is hard work.
I know. How do you think I feel? I do it all day. And so these band-like muscles here, they really pull down on the lower face right here. So you're actually finding that these are coming up from the chest, all the way up the neck, and into the tissues of the face. So they kind of pull down a lot. And if we inject along them, you stop them from being as strong, you stop them from pulling down, and you find the whole lower face tends to drift up a little bit. And when you do those last two sets of injections that I told you about in combination, it gives a really pleasing effect for the jawline, and that's commonly called a Nefertiti lift, which is named after a 14th century Egyptian queen.
I want to be there.
You want to be I don't know if I can make you a 14th century Egyptian queen. I can't give you like the tombs and the palaces and the gold, but I can give you the jawline.
That would do.
That's a good start, right? So I'm going to talk about just another area which a lot of people ask about, which is for excessive sweating. A lot of people sweat a lot from under the armpits, and they find that it stops them from wearing bright colors in the summer because you see sweat patches, and they really hate that. And it's a really good treatment to just inject under those if you have that problem, because a week later you don't really sweat from there very much. And you find that you can wear whatever colors you want, and it can be really, really liberating. It sounds funny, doesn't it? But for some people it's like a life changer because it opens up their wardrobe a lot. So that's probably the summary of all of the common treatments. Sometimes people ask me what the weirdest place that I've injected Botox is. I've actually, maybe for overactive bladder, I've injected it into people's bladders at times. But you're really, really lucky that that's not going to be part of our demonstration today, Nick.
I'm getting stressed. I need some Botox on my armpits.
On that note, we're going to do the demonstration. All right, come on. Okay, so let's look at the areas that we're going to do again. Just raise your eyebrows. Good. And let's do that one first. So just tilt a little, look at me, and relax. So. Good. And again. And relax. Well done. And just lift again for me. Relax again. And smile for me. Relax. Good. So this is the third area, the crow's feet, as we mentioned. And some people find it a little bit sore, but as you can see, Nicola's not too bothered by that. She's not reacting at all. So that's probably all we need on that side, pointing out a little bit. So, voila!
There you go.